Good evening, everyone. Hospitals across the country, including right here in Acadiana, are now using their emergency surge plans.
That means they're converting other departments into intensive care units amid a potential spike of coronavirus patients. 3's on the Street tonight. Our Chris Welty joining us live from Lafayette General with more on the work that's underway. Chris.
Marcel, Jim, doctors and leaders here at Lafayette General say they are prepared for an increase in patients. Earlier this afternoon, they held a virtual news conference to give us better insight on their COVID-19 response efforts across the healthcare network. Each day, doctors and leaders at Lafayette General Health evaluate the coronavirus pandemic and their overall plans.
To discuss where are we at with our surge plan, where are we at with our capacity system-wide, were there any needs across the system in regards to PPE, ventilators, and we discussed how we can move those resources around the system to ensure that everyone has what they need.
David Calicod, president of LGH, says the system is still concerned about a surge of patients like hospitals have seen in New Orleans and other areas of the country.
We haven't seen that dramatic surge. It's been a steady increase in patients, but we've learned an awful lot.
The healthcare system is cautiously optimistic moving forward after new models showed less of a spike of COVID-19 cases. Despite that, LGH has revised its masking policy at the recommendation of the CDC. Some areas are reusing masks as much as possible, and others are using homemade masks.
In the areas in which we have COVID patients, we are particularly careful with the infectious nature of that, so we do not reuse surgical masks in those areas. But in general, the other areas we use it as long as it is not damaged or soiled.
Throughout this unprecedented time, Lafayette General is making sure their staff is well rested and not only taking care of their physical health, but also their mental health. Each shift begins and ends with prayer.
Making sure they have the tools and equipment to do their job, and then reminding them to take care of themselves and rest when you can rest, when you're off, take off. And we've seen some good feedback from them and some learnings as well.
Like so many other hospitals, Lafayette General is moving staff to help where needed. They're also using virtual tools to check in on patients to limit the number of people exposed to the coronavirus. 3's on the Street live in Lafayette. Chris Welty, KATC TV3.
Our Lady of Lourdes is also implementing precautions on all of its campuses. Masks are being distributed to all staff and doctors, and visitation at the hospital remains restricted. And now to today's numbers. All parishes except Tinshaw Parish are